I'm Rajay Batniji, Chief Health Officer at Collective Health. I'm here with Sanjay Basu, Director of Research and Analytics, to talk about an incredibly challenging problem for all of us today, opioid addiction. Employers are really trying to do something about opioid addiction, but very few have succeeded. It seems like it's a real challenge.
Yeah, that's right. We only see about a fifth of employers having a program that really addresses opioid addiction. And part of that is a common belief that it doesn't actually affect the employed workforce in the United States. Actually, we find that a tremendous number of employees who are actively employed and productive are actually facing this problem.
And Sanjay, you've personally done and been involved in quite a bit of research on managing opioid addiction. What have you found?
There's a couple of key insights for folks. One is to start talking more broadly about a substance use strategy rather than just opioid addiction. One of the most recent papers in the journal Health Affairs revealed that although opioids have gotten appropriately a lot of attention, it's actually happening in parallel with a dramatic increase in deaths from stimulants and anxiety medications. So stimulants like Adderall for ADHD, anxiolytics like benzodiazepines, Ativan, for anxiety are actually causing death rates to rise in parallel. So that's very concerning and yet under-addressed. The other thing we've noted is an answer to this big debate that's happened over the last few years. Is it most doctors who are prescribing a little bit too much of this stuff, or a few bad apple doctors who are prescribing a tremendous amount? It actually turns out, contrary to what I had believed, that it's more the latter, that there's a few doctors who are prescribing a crazy amount of these substances. But that actually allows us to have an effective strategy. We've actually found that prescription drug monitoring programs can be effective, especially if they have rules that allow them to reach out to providers. A lot of those programs are more effective than simply changing prescription drug benefits, which we've seen people work around very easily. The third issue is many folks don't realize how medication-assisted treatment for opioids has changed a lot in the last few years. People have a lot of stigma around the traditional treatment, which is methadone, but actually there's a new player on the block called buprenorphine, or BUP. It's kind of like an oral vaccine for opioid addiction. It caps the receptors in your brain, and so even if you take opioids, nothing happens to you in terms of getting a high. Many people don't know that the treatment is available, which is why it's underutilized. So I think those are some key takeaways for HR benefits leaders.
Yeah. When it comes to workplace substance abuse, what kind of strategies can we think about there?
I think it's really important to not underestimate how much is hidden beneath the surface. So we're finding, for example, people in very high-profile, high-stress travel-related jobs are very at risk for stimulant use. The same goes for Adderall among computer programmers. These are populations that are particularly vulnerable, and we don't want people to underestimate how much need there is.
Wow, that's very concerning. Thank you for raising our attention to this. The latest article in the Breakdown series is now live online at collectivehealth.com/insights. We hope you'll visit, and we'll talk to you again soon.